Hi everyone, welcome back to NCLEX Practice Hub. Today, we're diving into a crucial topic for both nursing students and patients, crutch skills. Proper use of crutches can make a significant difference in patient recovery and mobility. Let's get started. There are three main types of crutches. Axillary, underarm, crutches, most commonly used, especially for short-term injuries. Forearm, Lofstrand, crutches, provide more support for long-term use and for patients with permanent disabilities. Platform crutches, used when patients cannot bear weight on their hands or wrists. Proper fit is essential for effective use. Height. Adjust the crutch so that there is a 2-inch gap between the crutch pad and the armpit. Hand grip. Adjust so that the elbow bends at a 15 to 30 degree angle when holding the grips. Here are the three basic gait patterns. 2-point gait. Move the right crutch and left foot forward simultaneously, then move the left crutch and right foot forward. 3-point gait. Move both crutches forward along with the injured leg, then move the uninjured leg forward. 4-point gait. Move the right crutch, then the left foot, followed by the left crutch, and then the right foot. To ensure safety, always wear appropriate footwear. Keep the crutch tips dry and free of debris. Avoid placing weight on the armpits to prevent nerve damage. Take small, manageable steps. Now let's answer this 5-question quiz to test our knowledge. Question 1. Select all that apply. Which types of crutches are commonly used? A. Axillary crutches. B. Forearm crutches. C. Platform crutches. D. Knee crutches. Correct answers: A, B, C. Explanation: the commonly used types of crutches include axillary, underarm, crutches, forearm, Lofstrand, crutches, and platform crutches. Question 2. Select all that apply. What are important aspects of ensuring proper crutch fit? A. 2-inch gap between the crutch pad and the armpit. B. Elbow bent at a 15 to 30 degree angle when holding the grips. C. Crutch pad directly under the armpit. D. Hand grip level with the hip. Correct answers: A, B. Explanation: proper crutch fit requires a 2-inch gap between the crutch pad and the armpit, and the elbow bent at a 15 to 30 degree angle when holding the grips. Question 3. Select all that apply. Which gait pattern involves moving both crutches forward along with the injured leg? A. 2-point gait. B. 3-point gait. C. 4-point gait. D. Swing-through gait. Correct answer: B. Explanation: the 3-point gait involves moving both crutches forward along with the injured leg, then moving the uninjured leg forward. Question 4. Select all that apply. Which practices help ensure safe crutch use? A. Wearing appropriate footwear. B. Keeping crutch tips dry and free of debris. C. Placing weight on the armpits. D. Taking small, manageable steps. Correct answers: A, B, D. Explanation: safe crutch use involves wearing appropriate footwear, keeping crutch tips dry and free of debris, and taking small, manageable steps. Placing weight on the armpits can cause nerve damage and should be avoided. Question 5. Select all that apply. What are the key differences between axillary and forearm crutches? A. Axillary crutches are used for short-term injuries. B. Forearm crutches provide more support for long-term use. C. Axillary crutches are also known as Lofstrand crutches. D. Forearm crutches are used when patients cannot bear weight on their hands or wrists. Correct answers: A, B. Explanation: axillary crutches are typically used for short-term injuries, while forearm crutches provide more support for long-term use. Forearm crutches are not known as Lofstrand crutches, and platform crutches, not forearm crutches, are used when patients cannot bear weight on their hands or wrists. Practicing these skills and understanding the basics will greatly improve mobility and reduce the risk of injury. Thanks for tuning in to NCLEX Practice Hub. Don't forget to like, subscribe, and hit the notification bell for more nursing tips and practice questions.